Hello everyone, I'm Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. In this May 2025 lecture series, we are going to discuss about medical images obtained with ionizing radiation in biomedical image processing. We know that ionizing radiation has a variety of applications in biomedical field. The three main uses of ionizing radiation in medicine are treatment, diagnosis, and sterilization. First of all, what is cancer? How do we use ionizing radiation for the treatment of cancer? We know that cancerous tumors which are out of control, actually cancers are growth of cells. As a result of this, they do not perform their intended function. This cancerous cells growth, it leads to malfunction of our normal cells. By treating this cancer, ionizing radiation plays a vital role. See the diagram. See the cell arrangement. The growth of cancerous cells leads to the malfunction of our normal cells. How do we use ionizing radiation for treating cancer? Actually, cancerous tumors, it can be treated using following three main methods. First one is chemotherapy, second one is radiation therapy, third one is surgery. Chemotherapy, we are using drugs to treat the cancer, and radiation therapy, radiotherapy and brachytherapy. Third one is surgery. See, the factors which affect the choice of treatment for cancer. Based on the size of tumor and position of tumor, we can fix the choice for treating cancer. See here, the aims of radiation therapy is to cause damage to the cancerous cells while minimizing the risk of surrounding healthy tissue. The damage or infected by radiation therapy, it causes the cancerous cells to stop reproducing and thus the tumor shrinks. But unfortunately, the healthy cells also can be damaged by radiation. Here, the amount of radiation given to the patient, it has to be accurately calculated so that the damage is limited to the cancerous cells only. First thing, we have to analyze the type of tumor, size of tumor, and the position where the tumor located. Based on this three elements, we can fix the amount of radiation given to a particular patient. See, in this treatment of cancer using ionizing radiation, radiation therapy plays an important role. Here, it is used to destroy cancerous cells. It has two main techniques. First one is radiotherapy, second one is brachytherapy. See, by treating cancer, three main phases are included. First one is planning, second one is simulation, and third one is treatment. See here, every treatment using radiotherapy, it has to be rigorously planned. This planning process consists of three phases: planning, simulation, and treatment. See the diagram. This diagram shows a perfect cancerous cell destroying through ionizing radiation. See the diagram, how effectively it destroys our cancerous cells without affecting healthy tissues. The main thing is we have to destroy cancerous cells as well as we have to protect our healthy cells. See the radiation treatment planning. Here in planning we use images from different medical imaging modalities like MRI, CT and X-rays, as well as we are using ultrasound. This cancerous tumor, it has to be located so that the size and position can be analyzed. This information can be obtained from X-ray, CT, MRI, ultrasound images. See, our next phase is simulation. In the simulation part, once the amount of radiation to be given, it has been accurately calculated, the patient then goes to the simulator to determine what settings are to be selected for the actual treatment using a linear accelerator. Here the settings are determined by taking a series of X-rays to make sure that the tumor is in correct position to ready to receive the ionizing radiation. See here, once the amount of radiation is accurately calculated, we have to make sure that the position should be corrected, because we have to destroy only cancerous cells. By receiving this ionizing radiation, with the help of correct position identification, we can easily destroy the cancerous cells. The position accuracy is important. while receiving the ionizing radiation. See here, our next phase is treatment. Here, the cancerous tumors can be treated by using radiotherapy as follows, like irradiation using high energy gamma rays as well as X-rays. Remember this, by destroying cancerous tumors, we use only gamma rays and X-rays. See this radiotherapy treatment. Here, irradiation using high energy gamma rays. Here we are using cobalt 60, a radioactive form of cobalt. Remember this, we are using a radioactive form of cobalt. This cobalt source kept within a thick heavy metal container. Here this container has a slit and it allows a narrow beam of gamma rays to emerge. With the help of this gamma rays, we can easily destroy our cancerous cells in a particular tumor place. See, and irradiation using high energy X-rays. See the diagram. Here X-rays are generated by a linear accelerator. Here the metal target and electron strikes the target. X-rays are produced. This produced X-rays are tapped into a narrow beam by movable metal panels. Here see the diagram. With the help of this produced X-rays, we can easily destroy our tumor parts. Radiation using high energy X-rays. And treatment of cancer, next one is radiotherapy. In this, here the apparatus is arranged so that it can rotate around the couch on which the patient lies. First one, radiotherapy using gamma rays. Second one is radiotherapy using X-rays. And here it allows the patient to receive radiation from different directions. The diseased tissue receives radiation all the time, but the healthy tissue receives the minimum amount of radiation possible. Here in treatments, they are given a series of small doses because cancerous cells are killed more easily when they are dividing, and not all the cells divide at the same time. This reduces some of the side effects which comes with radiotherapy. Okay, our next one is brachytherapy. See, this involves placing implants in the form of seeds, wires or pallets directly into the tumor. Such implants, it may be temporary or permanent depending on the implant and the tumor size. The benefit is it receives nearly all the dose, while healthy tissue hardly receives any. Here, brachytherapy is mainly used to treat cancers in a final stage. Actually, it gives rays only to the tumor place, and healthy tissues hardly receives any of the X-rays, any of the rays. Okay, see radiation therapy diagram. Brachytherapy is mainly used to treat the following cancers like uterus, cervix cancer, prostate cancer, and intraocular cancer, skin cancer, thyroid cancer, bone cancer. Next one is tracers. We will discuss about tracers in next class. Thank you.